जी एक एक करके फोटो भी हाथ चलना जाए. ओके. राइट जी. थैंक यू. ਤੁਸੀਂ ਇੱਥੇ ਖੜੇ ਹੋ. ਤੁਸੀਂ ਖੜੇ ਹੋ. ਸ਼ਰਮਾ ਜੀ ਉਹਨਾਂ ਰਿਸੀਵ ਕਰੋ ਸਾਰਿਆਂ ਨੂੰ.
तो मैं करूँगा मैं तेरे हो
ਇੱਥੇ ਇੱਥੇ ਕਰ ਲਓ. ਚਲੋ ਜੀ ਆਓ ਜੀ. ਲੋ ਜੀ ਸਰ. ਫੋਟੋ ਲਾਓ ਚਲੋ ਜੀ.
फिर फोटो ना खिंचाने
ਥੋੜੇ ਜਿਹੇ ਬੰਦੇ ਆ ਯਾਰ. ਚਲੋ. ਆਓ ਜੀ ਨੈਕਸਟ ਫਰੰਟ
आइए निकोस please come निकोस
Yes, sir. Another picture, please. Yeah. Right, sir. Somebody. Thank you. Next one, please. Okay, sir. One more. Next one, please. Roji, yes, sir. That's it. Thank you. Sorry, no.
Siti Devi my best friend in the world.
Oh, Benji, yes. Yes, please look this side. Amar Mansa. Okay. Okay. Then. Next one, please.
Hello, please come in. Adanita, the governor of England, my wife.
I know. You got it.
चंगी तरह देख लेता फोटो
एक के लिए
सही तरह फोटो फोटो सही तरह
अरे कमजोर बड़े हो गए यार.
तुसी कितना है
चलो जी.
नाइस टू मीट यू आगे बढ़ते सबसे आगे प्लीज कम इन माय डॉटर
अच्छा कमजोर लग रहे हैं मैं कुछ. ओके. वन मोर. थैंक यू.
अंजू भाई ए हीरो माय डियर बेबी आ जाओ आ जाओ
राइट सर.
अंजू भाई चेयरमैन me and him
थैंक यू.
please come आइए डॉक्टर अनिल पटेल from London that's the photo
Okay. Thank you. Thank you. Thank you.
Dr. Garg the chairman number 2
Yes, sir.
No sir
Okay, sir.
thank you please come आइए भी देखो दो
Hello, जी. Okay, जी. Right, जी. Thank you.
डॉक्टर सोहन
हाँ लिया.
फोटो फोटो आगे सारे लोग सब लोग
Thank you.
we wait only half minute and we start क्या अनिता हेलो
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 बेटी है बुलाया जी ने
There are two type of water. One is sparkling, one is natural. You can see it's water late, and we will finish in time for the lunch 1 o'clock. So I request everyone to switch off the mobile phone, please. Switch off mobile phones, otherwise there will be disturbance. Sorry, I was late for some reason. And we are going to start in 1 minute. Before that, I welcome you again. Happy?
Yeah, I'm fine.
Thank you. I have some most loved, then I will tell you why I didn't invite him today. The first reason is the number of attendance very low. The boss attended very big events, 150 and more. Lot of visa rejected from India, Pakistan, Ghana, Sri Lanka, and other countries. So, we don't care how many we are, but we are sincere. We are going to enjoy the day learning something extra in homeopathy. I'm not saying you learning today. You know homeopathy, but you will learn extra. So, without delay, I'm going to link to someone whom I respect. So you will enjoy that. What is going to happen now? Give me 1 second only. I'm going to give a call.
Oh, good morning.
Where is the boss?
I'm afraid you just missed him.
Oh my God, because I delayed. So where is gone? When will he be back?
Probably about 1 o'clock-ish.
1 o'clock, no problem. I call 1 o'clock.
Okay then.
How are you, madam? You okay?
Yes, I'm fine, thank you.
Oh, thank you, madam. I'm sorry I was late. That's why I will call again 1 o'clock, you know. So, hello.
Yeah.
Hello. I invite my dear friend. He is a regular attendee of all the events. So, I love him from my heart. My friend, Dr. Devinder Singh ji. Please come and start your thing. माइक्रोफोन है वो है वो वाला ये लेना ये ले लो वो लेना
Can anyone hear me or
That should be.
ले लो डॉक्टर साहब ले लो चलो
Take this is better.
इस पर क्या है?
thank
That's the
you.
first you introduce yourself and your
Okay.
background, then it will be better. Dr. Devinder Singh is a highly busy homeopath in UK. So please tell your name and address and everything so that they know.
I am Dr. Devinder Singh. I qualified as homeopath from DHMS from Homeopathic Medical College, Chandigarh in 1983. So,
Perky?
Yeah, yes, it's all right.
Doctor, volume बढ़ा. आ रही है आवाज आ रही है?
thank you everyone for attending this International Homeopathic Congress, London. I am Dr. Devinder Singh and I qualified from Homeopathic Medical College, Chandigarh in 1983. So I moved to UK. I am practicing in UK. I've been member of the Homeopathic Medical Association UK for about more than 15 years, 20 years rather, and I was a council member of the medical association as well. So this is my first ever lecture that I am presenting to the audience in front, so don't please mind if I make any mistakes,
No
etc.
mistake, I know.
Yeah.
Take photo which all the company. One photo will come on the. Okay, one more, sir. One more, last one. That's it.
So Dr. Sharma, he phoned me that can I present a lecture on the topic called the incurable diseases in homeopathy. So I wasn't sure what I was going to do, but I managed to get some information. There are three words. One is the homeopathy, other is the diseases, and the third is the incurable. So these are the three words I'm going to concentrate my presentation on. And I will take the support of the Organon of Medicine, the 6th edition of Organon of Medicine by William Borick. So before I set on to the incurable diseases, I'm just going to give you a basic introduction what homeopathy says or what Organon of Medicine says. I'll start with the aphorism 1. Which says that the physician's high and only mission is to restore the sick to health, to cure as it is termed. And then the sixth, aphorism 6, which says the unprejudiced observer, well aware of the futility of transcendental speculations, which can receive no confirmation from experience, be his powers of penetration ever so great, takes notes of nothing in every individual disease except the changes in the health of the body and mind, morbid phenomena, accidents, symptoms, which can be perceived externally by means of senses. That is to say, that he notices only deviations from the former healthy state of the new diseased individual, which are felt by the patient himself, remarked by those around him, and observed by the physician. So all these perceptible signs represent the disease in the whole extent that is together, they form the true and the only conceivable portrait of disease. So that's the definition of the disease as of the organome, or aphorism 6 of the organome of medicine. Okay, then the aphorism 8, which concentrates on cure, is the removal of the totality of symptoms. So the disease is represented by the totality of symptoms. So it says, so it is not conceivable, nor can it be proved by any experience in the world, that after removal of all the symptoms of the disease and the entire collection of the perceptible phenomena, there should or could remain anything else beside the health. So, or that the morbid alterations in the interior could remain uneradicated. So that means the disease is represented by the signs and symptoms, and once those signs and symptoms are removed, so there is nothing left apart from the health. So this is about the health. And then aphorism 9, which says that in the healthy condition of man, the spiritual vital autocracy, the vital force, the autocracy, the dynamism that animates the material body, organism, rules with unbounded sway. Retains all parts of the organism in admirable, harmonious, vital operations as regards both sensations and function, so that our indwelling, reason-gifted mind can freely employ this living, healthy instrument for the higher purposes of our existence. Okay, then in aphorism 26, which explains about the homeopathic system of medicine and the definition of health again. So what it says is, so this depends on the following homeopathic law of nature, which was sometimes indeed vaguely surmised, but not hitherto fully recognized, and to which is due every real cure that has ever taken place. So the weaker dynamic affections is permanently extinguished in the living organism by a stronger one, if the latter, whilst differing in kind, is very similar to the former in its manifestations. it is the law of cure, which is like cures like, that they, even if there are a natural disease is present in the human body, and or a stronger natural disease comes into the body, and it will cure the existing disease. So in other words, the similar diseases are cured by the similar symptoms as well. Okay, then there's a aphorism 70, which describes about the homeopathic system of medicine and the definition of health. Natural disease can never be cured by medicines that possess the power of producing in healthy individual an alien morbid state, dissimilar morbid symptoms differing from that of the disease to be cured, never therefore by an allopathic mode of treatment, and that even in nature no cure can take place in which an inherent disease is removed, annihilated, and cured by the addition of another disease dissimilar to it, be the new one ever so strong. So that moreover, all experience proves that the means of medicines which have tendency to produce in a healthy individual an artificial morbid symptoms antagonistic to the single symptom of disease ought to be cured. The cure of a long-standing affection will never be effected, but merely a very transient alleviation, always followed by the aggravation, and that in a world this antipathic and merely palliative treatment is long-standing, diseases of serious character is absolutely inefficacious. So that, however, the third and the only other possible mode of treatment, the homeopathic, in which there is employed for the totality of symptoms of a natural disease a medicine capable of producing the most similar symptoms possible in a healthy individual given in suitable dose, is the only efficacious remedial method whereby the diseases which are purely dynamic, deranging irritations of the vital force are overpowered, and being thus easily, perfectly, and permanently extinguished, must necessarily cease to exist. So this is brought about by the means of stronger, similar, deranging irritations of the homeopathic medicine in the sensation of the life principle. For this mode of procedure, we have the example of unfettered nature herself, when to an old disease there is added a new one similar to the first, whereby the new one is rapidly and forever annihilated and cured. So that is the principle of homeopathy explained. Diseases, we must still, alas, reckon those so commonly met with artificially produced in allopathic treatment by the prolonged use of violent heroic medicines in larger and increasing doses, by the abuse of calomel, corrosive sublimate, mercurial ointment, nitrate of silver, iodine and ointments, opium, valerian, cinchona bark, and quinine, foxglove, prussic acid, sulfur and sulfuric acid, perennial purgatives, venisections, shedding streams of blood, leeches, issues, satins, and whereby the vital energy is sometimes weakened to an unmerciful extent, sometimes it is sometime if it do not succumb gradually abnormally deranged by each substance in a peculiar manner in such a way that in order to maintain the life, in order to maintain the life against these inimical and destructive attacks, it must produce a revolution in organism and either deprive some part of its irritability and sensibility or exalt these to an excessive degree, cause dilatation, contraction, relaxation, induration, or even total destruction of certain parts, and develop faulty organism alterations here and there in the interior or the exterior, cripple the body internally and externally in order to preserve the organism from complete destruction of life by the ever-renewed hostile assaults of such destructive forces. Laws of fluids and strength, because venisections, even from the affected part, only tend to increase renewed inflammation of these parts, and precisely so it is generally inappropriate, murderous to take away many pounds of blood from veins in inflammatory fevers, when a few appropriate medicines would dispel the irritated arterial state, driving the hitherto quiet blood fluids and strength. So such great loss of blood is evidently irreplaceable for remaining continuance of life, since the organs intended by the Creator for blood making have thereby become so weakened that whilst they may manufacture blood in the same quantity but not again of the same good quality. And how impossible is it for this imagined plethora to have been produced in such remarkable rapidity, and so to drain it off by frequent venisections when yet an hour before the pulse of the heated patient, before the fever and chill state was so quiet, or too much strength. On the contrary, every sick man lacks strength, otherwise his vital energy would have prevented the development of the disease. Thus, it is irrational and cruel to add to this weakened patient a greater, indeed the most serious, more particularly in recent times, are all chronic diseases, the most deplorable, the most incurable, and I regret to add that it is apparently impossible to discover or to hit upon any remedies for their cure when they have reached an inconsiderable height. Okay, aphorism 76 as well, which says, so there's no and there no and cannot be any human healing art for such complicated. So only for natural diseases has the beneficent deity granted us in homeopathy the means of affording relief. Thus, those devastations, maimings, and human organism exteriorly and interiorly affected by years infrequently of the unsparing exercises of the false art with the hurtful drugs and treatment must be remedied by vital force itself, appropriate aid being given for the eradication of any chronic miasms that may happen to be lurking in the background. So it is, if it has not already been too much weakened by such mischievous acts, and can devote several years to this huge operation undisturbed. A human healing art for the restoration of the normal state of those innumerable abnormal conditions so often produce disease, health, and incurable. So we've seen that the law of similar is the only method by which we can cure the diseases. So as long as there are symptoms, so the patient exhibits signs and symptoms, and once those signs and symptoms are annihilated, so the disease is cured. But with the complexity of the continued overuse of the allopathic drugs, and it makes it so complicated that the disease becomes incurable. So my question is, so once we know that the disease is incurable, once we know that the machine is irreparable, so what do we do?
Anyone?
Anyone can answer the question. Once a car becomes irreparable, or any machine becomes irreparable, what do we do with that?
Replace.
Hmm?
Replacement.
Replacement.
Right after.
No, it is already irreparable. It is irreparable. Okay, so we look around. Yeah? If the person where we have gone to get the item repaired or get our body repaired, if he says that the disease is incurable, irreparable, so what would the patient do? So he will look around. Can somebody else give him the hope? Can somebody else give him the hope that I can be repaired or my machine can be repaired? So this is what I did when I found that the homeopathy or any other pathy cannot help in So, forgetting the transcendent Lord, all sorts of illnesses are contracted. So, har aradhya hoya arog. So, worship and adore the Lord, har, and you shall be free of disease. There's another word which says, Ram Chand ki lastika jin marya rog. So this is the Lord's healing rod which eradicates all disease. I don't know about the historical event in this line, but somebody who knows, they can let me know. I will be. Na buddha bahut haya. So you tell lies, you do not practice what you preach, your desires are not satisfied, what a shame. So now I come to incurable disease. So it says, Asad rog upjaya sant dukhan, deh binasi maha khaya. So you have contracted an incurable disease, slandering the saints, your body is wasting away, you are utterly ruined. The inner knower, the searcher of hearts, knows everything. What can anyone hide from him? Hast pav chare khin pitar agan sang la jareo. So your hands and feet will fall off in an instant when you are burned in the fire. So mude te mante ram bisareo. You fool, you have forgotten the Lord from your mind. So loon khaye kare haram khori pekhat nan bidareo. So you eat his salt, then you are untrue to him. Before your eyes you shall be torn apart. So asad rog upjo tan pitar tarat nakahu tareo. So incurable disease has arisen in your body. It cannot be removed or overcome. Pamatma. So, O egotism, you are the root of birth and death and the cycle of reincarnation. You are the very soul of sin. So, mitrant tajant satrant dedant anik maya bistirna hai. So you forsake friends and hold tight to enemies. You spread out countless illusions of Maya. Avant, Javant, Thakant, Jia, Dukh, Sukh, Baho, Pogna hai. So you cause the living beings to come and go until they are exhausted. So you lead them to experience pain and pleasure. Pram, Pyan, Udyan, Ramanang, Maha Bikat Asad Rogna hai. So you lead them to wander lost in the terrible wilderness of doubt. You lead them to contract the most horrible, incurable diseases. Well, at least the Guru Nanak, he doesn't consider that even the concept is different. So he considers the moment we forget the name of the Lord, so we are diseased. So the moment we remember God, so this is life for us. So as long as we are alive, we've got the disease and health, but we are alive only as long as we remember the Almighty God. The moment we forget God, so all kinds of troubles, diseases, whether physical or mental, they come in and empower you. Okay, any questions you have got so far, I will try to answer.
Any question, please? Any clarification?
Nice lines for Guru Granth Sahib.
Yeah, these are from the Guru Granth Sahib.
Very nice.
You spotted it.
Used to read sometimes.
Yeah. Thank you ever so much for listening to me. This was my first presentation. I'm not very much confident, but
You are.
Sure, sure.
Hello. Homeopathy. Thank you, Dr. Saab. We all thank you. Thank you. Our next speaker is Dr. Anita Povatodi. Before that, I take 2 minutes from Dr. Ranjit Kaur. Please come.
Thank
Here for you.
Good morning, everyone. My name is Ranjit and I work in health sector. First of all, I'm very thankful to Dr. Sharma to inviting me to attend this conference. We have known to Dr. Sharma for a long time, years and years, and his contribution to the homeopathy and the society is not measurable. He has done a lot of work. One particular thing I want to let you know. One of my friend, she has been diagnosed with cancer few months ago, stage 4. She had cancer before, few years ago. She was in remission, then she got it again. And the doctor said she won't survive. And she's not from our community, she's from different community. She was, as Dr. Devinder said, she was looking something, what can help her. So we consulted with Dr. Sharma and she started to take medicine from Dr. Sharma. And I will glad to tell you that it has been not in remission, but it has not spread. And doctors are also like thinking what's happening to her. So they're telling her, do what are you doing? But your cancer has not spread. She couldn't come today to attend the conference because sometimes she feels weak and she can't sit for a long time. But she told me to pay her regards to Dr. Sharma and thanks him for all the treatment, everything that he's given to her. He has given her a hope. He has given her the stage where she can do the things. And also the cancer is not spreading. I think is a very good example of homeopathy, how it can work. And thank you, Dr. Saab, for all your work and everything. Thanks a lot.
Thank you very much. Thank you. Dr. Anita, you are ready? Then come here. Dr. Lakur Sameer is missing from United Kingdom. Come here, doctor. You were in the back seat, yeah? God. Dubai. My dear Sandeep Nath is like my brother. And this young lady is the highest educated homeopath in the United Kingdom. It is the first time, so please give her support. Ravi ji, welcome, I know, welcome, I seen you. Ravi ji. So, she did BHMS in India, then she did MD, then she did PG Home London, finally she did fellowship. So Anita is like my daughter. My wife is sitting next to her. She's loved by all. She's very good. And my young hero, what happened to your teeth? Oh my God. He's a very, very naughty boy, but he's very good today. Huh? Thank you very much. Huh? So everything okay? All right. Thank you.
Let me thank
You
Dr.
could speak loudly.
Dr. Sharma sir for giving me this opportunity. And my topic today, the topic of my today's discussion is about eczema, efficacy of homeopathy in the treatment of eczema. So eczema is mainly it is a common problem affecting most of the people, right? So eczema, it's not a disease as such. It is a group of, it is a chronic inflammatory dermatitis mainly. So it consists of a group of skin disorders, and it varies according to the stage of the disease. So mainly it is non-contagious inflammation of the skin and is characterized by few symptoms. It consists of pruritus, erythema, edema. There will be papules and vesicular formation, scaling, crusting, and lichenification. So these are the main symptoms of eczema. So mainly the eczema is divided based on the morphology. It is divided into acute phase, subacute, and chronic phase. In the case of acute phase, mainly there will be erythema, edema, and vesicular formation, oozing, and crusting. Mainly crusting, and sometimes blister formation also will be there. And later on in the subacute phase, there will be different tendency towards cutaneous infections, then nipple eczema, tendency towards non-specific hand or foot dermatitis, then Danny Morgan infraorbital fold. Then it is a fold under the eye along with the eczema. In this ectopic eczema, there will be a fold, formation of a fold. Then facial pallor or facial erythema, sometimes pityriasis alba. In those patients, there will be pityriasis alba or anterior neck folds, severe itching while sweating, intolerance to wool, and lipid solvents, food intolerance. These are all the major and minor criteria of ectopic eczema. So, the complications of ectopic eczema, secondary bacterial and viral infections, cellulitis, and impetigo. And the laboratory findings consist of skin biopsy. In that, you can see the spongiosis or inflammatory cell infiltration, edema, and vasodilatation in the dermis. This management is like corticosteroid in case of allopathic acid. Okay. So this is next one is seborrheic dermatitis. In case of seborrheic dermatitis, we can say this is a chronic inflammatory dermatosis with a characteristic distribution of lesions in the area reaching sebaceous glands. Okay. Mainly, the milder form is called pityriasis alba. It's called dandruff. In case of infants, it's called cradle cap in infants. Then next is etiology. Mainly the exact cause is unknown. Then yeast plays an important role. Mainly the lesions will be of coin shape, and there will be itchy circular oval lesions with the papilla vesicles or papules and scales on an erythematous base. It consists of acute phase and subacute phase in case of nummular eczema, and mainly seen in older age groups. Affects mainly hands, feet, legs, thighs, and trunk, hand. This is phototoxic dermatitis. Infectious dermatitis mainly it is caused by the microorganisms or their products. It is caused by sensitization, but is not due to the invasion of the microorganism. It is due to the sensitization. It clears when the organisms are eradicated. Mainly it occurs due to the poor hygiene, trauma, or macerations, sweating, or friction with the clothing and scratching are the aggravating factors in case of infective dermatitis. And the clinical features consist of erythema with tiny vesicles followed by oozing and crusting with an underlying raw area. Fissuring occurs by oozing in interstitious areas. Discharging sinuses in osteomyelitis, infected wound and ulcers are the conditions around which infective dermatitis may develop. So it is caused by microorganisms or their products mainly. So next is the therapeutic part of eczema. Therapeutic part consists of, there are so many medicines, constitutional approach or acute approach. In case of constitutional treatment, we can take the person's case as a whole and we can give the constitutional medicine. So here I am presenting few medicines like Arsal. Arsal mainly the main important key factors are restlessness and the dry, rough, scaly patches, mainly aggravation, cold scratching, there will be irritable weakness, and aggravation, midnight aggravation, and cold aggravation. So the eczema with itching, burning, swelling, and restlessness. Eruptions are papular eruptions, dry, rough, scaly, and mainly.
Don't worry, carry on. They are enjoying. Everybody enjoying her lecture.
Yeah.
Next is the patient named Ms. J, age 27 years, and female, and education has been as nursing, and she is working as a nurse, working in Manchester. And she came with complaints of raised eruptions on face, neck, elbow region, legs, back, and abdomen with severe itching, which started 2 months back and raised in the last 3 days. Then this is the complaints in the location, face, right side since 3 months. There is redness, eruption, dryness, itching. The main aggravation during night and cold weather. Along with that, sleep was disturbed due to the itching and weakness. Eyelids, swelling in the eyelid, and the chin area, eruptions, red eruptions, itching. Nose, redness and swelling, main aggravation during night hours. Abdomen, itching and round patches and redness, aggravation night and cold weather aggravation, and sleep was disturbed along with the complaints. Same like in the elbow region also, redness, eruption, dry itching, main aggravation during night and cold weather, and sleep was disturbed. Thighs, both sides, small round eruptions, itching and red color, dryness, night aggravation and cold weather aggravation. Axilla, and her complaints improved, and for the next visit, number 40 pills was given, and finally sulfur 200 given, and the patient was improved. She was better. And there are few photos which I just wanted to show. This was the previous before treatment and the after treatment. That was previous one and the after our homeopathic prescription. These are the few slides. So I just wanted to show the efficacy of homeopathy in the case of our, because steroidal injections, everything, it came out, and with the help of homeopathy, she came to normal. She can work now. She's going to hospital every day, and she's happy. Thank you. Thank you very much. Any questions?
No question. Everybody satisfied. It was her first lecture. I am very, very happy. She did it properly and with full confidence. Thank you, Anita.
Thank you, sir. Thank you. Thank you so much.
Thank you. USB. Thank you. In the meantime, I have good news. My favorite and very, very intelligent doctor, Mirjana Jivanov, is here. From Serbia, Dr. Kelemen, Dr. Promovic. Last time something happened that was not good, but I am sharing with you. They were late at the airport, the plane fly without them. So happy, I'm very happy that you are here. So you can have tea and coffee if you want there, Dr. Mirjana. Yeah.
Just wait, Dr. Rekha will not deliver the lecture after that.
Okay, in the meantime, there is some change in the program. Dr. Rekha Juneja. Dr. Ji, welcome. You put your... Dr. Bhagwant Kaur Ji Maan, ਤੁਸੀਂ ਸਵੇਰੇ ਤੋਂ ਮਿਲੇ ਹੀ ਨਹੀਂ ਸਾਨੂੰ। ਡਾਕਟਰ ਰਣਦੀਪ ਸਿੰਘ ਜੀ ਕਿੱਧਰ ਹੈ? ਉਹ ਪਿੱਛੇ ਬੈਠੇ। So, international registrar. And by the way, I have to tell you something. Dr. Anita, who just presented, she is a registrar of homeopathy. And our Tony Haynes, he's not feeling well, so he said he will come around 4 o'clock. Our chief registrar, senior registrar. Okay, Dr. Ji, thank you. I'm Dr. Padma Priya Nair from Kerala. She's supposed to do this program, but I'm doing with for you. Actually, there was some family problem. Yeah, things happen. So I want to ask you your education and your everything.
Good afternoon, everybody. Myself, Dr. Rekha Juneja. I am from Tantia University, Shri Ganganagar, Rajasthan, India. And I did my BHMS and MD from Punjab. After that, I have been teaching since 10 years in Tantia University in the Department of Materia Medica. And also doing own practice last 15 years. And today my topic is incurable diseases and homeopathy. According to modern pathy, incurable diseases refer to the medical condition for which there is currently no definite cure. While treatment exists that can manage symptoms, slow disease progress, or even significantly improve patients' quality of life, these interventions cannot be complete, eliminate the disease. The inability to cure these conditions often from their complexity, whether due to genetic factor, due to autoimmune, persistent infections, or any degenerative processes that our current medical terminology cannot fully reverse, especially in modern pathies. Incurable diseases compose a wide variety of illness, including the chronic conditions like diabetes, hypertension, some genetic disorders like cystic fibrosis, and neurodegenerative diseases also, and some autoimmune conditions like the lupus and the viral infections such as HIV and AIDS. The impact of these diseases is significantly not only on the health of the individual but also on their social, emotional, or the economic well-being, as a long care is often required. There are some examples of the incurable diseases that includes some chronic conditions like the diabetes type 1 or type 2, hypertension, This is generally managed through the lifestyle changes or by medication, but not cured. Asthma, a chronic respiratory condition that can be controlled with medications but not cured. And autoimmune diseases like the rheumatoid arthritis, an autoimmune disorder causing the inflammation of the joints, and it has no cure but can manage with drugs and the lifestyle adjustments in modern pathy or in the conventional treatment. Like the lupus or the MS, and there's some neurodegenerative disorders like the Alzheimer's disease, a progressive neurodegenerative disorder that causes dementia with no cure but symptom management therapies. In Parkinson's disease, another neurodegenerative disorder that primarily affects the movement with no known cure. And there's some genetic disorders, the cystic fibrosis, a hereditary condition affecting the lungs and digestive system, managed through the medications or the physical therapies, and sometimes lung transplant also. And sickle cell anemia, a genetic blood disorder that causes the red blood cells to take on crescent shape and leading to the various complications. And there's some viral disorders also like the HIV, herpes simplex virus, hepatitis B and C. And the last one is the cancer. While many types of cancer can be treated but into remission or even eradicated in some cases, others may return or remain incurable, especially if caught at later stages. And the management of the incurable diseases in the modern pathy, they manage by the medication to control the symptoms, slow progression or reduce the flare-ups. And there's some life changes also to manage the conditions that affects, like in diabetes to manage the diet, or in arthritis by exercises. And there's some surgical procedures also for improving the quality of life. And psychological support, especially important in the neurodegeneratives and the chronic conditions. How in homeopathy, what is incurable disease? The role of homeopathy in incurable diseases centers around the holistic symptom management, improving the quality of life and supporting the body's natural healing process. And it depends upon the individual treatment. Homeopathy treats the person, not the disease. Even in incurable cases, the aim is to improve the overall well-being and vitality of the patient. We treat the overall the patient, not particularly disease. And in homeopathy, we palliation and the symptom management in cases where the disease is considered incurable due to advanced pathology or the extensive damage. Hahnemann advocate the incurable diseases under the palliative care. He emphasized that while homeopathy may not be able to restore complete health, it can relieve sufferings, but in homeopathic approach is not a substitute for the conventional cancer treatment, but is often used as a complementary therapy. Remedies may be prescribed to alleviate the symptoms such as pain, nausea, and the side effects of the chemotherapy, and the mental emotion distress. And the remedies like arsenic, phosphorus, and carcinogens. It depends upon the totality of the symptoms. And in neurodegenerative diseases, the conventional view, they are the progressive and the incurable, with treatment focusing on the slowing the progression and managing the symptoms. But in homeopathy, remedies are chosen based on the specific manifestations, such as mammalsora, psychosis, and syphilis. Chronic diseases are considered under incurable when their underlying miasm has progressed too far and is improperly treated. This is particularly emphasized in chronic conditions where the vital force is severely weakened and making complete cure unlikely. Depression or the feeling of hopelessness, homeopathy addresses the mental emotional plane in addition to the physical symptoms. In HIV or the AIDS, in modern pathy, The nature of incurable diseases, according to Organon of Medicine. The structural integrity of the body has been irreversible compromised. The patient's vital force is so diminished that it cannot respond adequate to the homeopathic treatment. And the disease caused by the medical interventions or any steroids, particularly through the use of the strong suppressive drugs that have disturbed the natural disease expression. In aphorism 183 to 186, these aphorisms explain the limitations of homeopathy in treating which was the diabetes or inhibit the body's response to insulin. Remedies like Ignitia, especially for the grief, Natramine for the suppressed emotions, and Sepia for the hormonal imbalance or for the stress also can be helpful. Long-term approach. Homeopathy is typically seen as a long-term treatment for the diabetes, aimed to improve the functioning of the body and minimize the complications. It does not aim to replace the conventional treatment, but many patients use homeopathy alongside the conventional medicine to improve the overall health and potentially reduce the dependency on the medication under proper medical supervision. Treatment in different types of diabetes. Type 1 diabetes, it is an autoimmune form of diabetes. Homeopathy aims to support the immune system and manage symptoms. Remedies are chosen based on the patient's general health and the symptoms. Type 2 diabetes, homeopathy seeks to correct the metabolic disturbance and address the insulin resistance, lifestyle factors, and the emotional components that contribute to the disease. Gestational diabetes treatment.
Thank you. Any question? Don't worry, free ask. She's a highly qualified homeopathy doctor from India.
Excuse me.
Any question? Thank you, doctor. Thank you.
Yes, questions, sir.
Yeah. Any question? Yeah.
I was asked regarding any heart disease are you treating and cured with the homeopathic medicines?
So it depends upon the patient, condition of the patient, especially hypertension, if it causes hypertension or any acute conditions.
No. Have you cured the completely hypertensive patients?
No, sir. Very nice, well done. Thank you.
She is honest. She's not lying. Okay. Thank you. So our next speaker is Alpha right here. Change करना है तो
हाँ मैं चेक करूँगा प्लीज फोन अभी चेंज करो पेन ड्राइव लेके नहीं गए हाँ
First of all, thanks to God, I am here with you. And next, thanks to Dr. Sharma, who gives the opportunity to me to come here and share my views with you. And you all are present here, and thanks to all of you. I'm also professor in Tantia University, Sri Ganganagar, and practicing in Bathinda from last 25 years. First of all, raise your hand who believe in God.
double hand. Very good.
Nice. We all are believing in God. Then homeopathy, as per my opinion, is a pathy, is a treatment of a God. One thing I tell you, first of all I tell you in Punjabi, say इलाज दे तीन पदर, इलाज दे तीन पदर, मन, शरीर अते आत्मा. It means that there is 3 stages of a treatment, that is first mind, body and soul. And homeopathy cover all these three things. No other treatment in the world treat all these three things. If we treat the man, all three things will be treated. Otherwise, no complete cure in the human body. Because someone treat the mind, someone treat the body, and some religions, our gurdwaras, mandir, masjid, they are treated the soul. But whole treatment only in homeopathy. We treat mind, man. We treat body. We treat soul. That's complete cure if in anywhere is in homeopathy. But as Dr. Sir, your name, what's your good name, Dr.
Devinder Singh.
Dr. Devinder says, whenever a car is unable to repair,
Yeah.
what can we do? Leave on God.
Take it to salvage.
Yeah, definitely. Because nothing is permanent in this world, on earth. Nothing is permanent. Why we think we homeopath, we are responsible for whole world. But I say one thing, homeopathy, अगर मैं इसको फिर एक बात, because I am from Punjab, तो मैं पंजाबी में कहूँगा कि एक बंदा मर रहा है, one person is dying with cancer, the allopathy and other treatment gave radiotherapy, chemotherapy, and what's the condition? No one is live. उसने मरना ही है, must be die. But homeopathy gives some relief, color, relief in mind, because relief in symptom, उसकी जिंदगी में जितनी बाकी है, the left life रंगीन, कलरफुल बनाता है. Homeopathy is only pathy, defective cure, definitive cure to fully eliminate them from the body. However, in many cases, symptom can be controlled and quality of life can be significantly improved with the medical management. We already says number of diseases as just like a cancer and others, last stage of cancer. जो says कि when car is not a curable, not a in that condition, what can we do? We improve the life. We improve the peace. We improve the rest time. Same thing, list of incurable disease like diabetes, rheumatoid arthritis, lupus, psoriasis, Graves' disease, HIV, hepatitis B, C. But one thing is, I say it's just a theoretical. In practical, number of diseases are there which are curable, like hepatitis, right? And Parkinsonism, cystic fibrosis, and number of diseases which is rheumatoid arthritis, which is curable with the help of homeopathy. Whenever we go for the totality of symptom, we go for the single, peculiar, and rare symptom. Whenever our symptom, because I say one thing, homeopathy is a art and science, and one thing is more, homeopathy is a math. When 2 and 2 is a 4, then your mathematics is okay. When your disease symptom and the medicine symptom, remedy symptom are matched, and your remedy is as per our master says, your selection is good. So there is a number of incurable diseases that we cure. There is no doubt. maybe as a WHO and as a medical, modern medical science say that these diseases are God, you know, every person on this hall, on whole UK, on this earth, having a different thumb impression. Homeopathy is based on individualization. That's why I'm saying homeopathy is very close to nature. Law of individualization is our basic law of homeopathy. God never made two persons same. Homeopathy says same. Never two patients are same. They are individualized. Constitution treatment, miasmatic theory, already Dr. Rekha, Sora, syphilis, psychosis. Similimum is our, again, one law of homeopathy. Give the similimum as per your symptom, as per your, not a disease symptom are not considered the symptom of a person, symptom of a man, condition of a man. In between I tell you one thing, Dr. M.L. Sehgal, who gives the very wonderful books on mind technique and all these things. Many times I follow Dr. M.L. Sehgal. I tell you one thing. One day, in a seminar, before seminar, at a night we are at dinner, Dr. M.L. Sehgal says, Dr. Garg, you know, what do you mean ailment from pregnancy? Ailment from pregnancy, vomiting ameliorate. Ailment from paralysis. I said, yes sir, because all we knows, but you know, these all symptoms are in mind. No sir. Why? Okay, morning you go to your room, morning I ask you, why these symptoms in mind chapter? Paralysis, why not in extremities? Vomiting, why not in stomach? And pregnancy, why not in women, females? Tell me, anyone, why these symptoms are in mind chapter? Dr. Hahnemann gives these symptoms in mind chapter. There is a big philosophy. Tell me. Sir, we go to dictionary. Pregnancy is not the meaning in womb. Pregnancy is something we take from outside, something from in our body and multiply in our body. Not in womb. In our body. Someone give me, hey, Dr. Garg, who are you? Why? He told me. He gave me one thing and I multiply in my mind. And after that I got headache. That is pregnancy in my mind. Yes, it's a philosophy. Try to understand the philosophy of Dr. Hahnemann. Pregnancy in our mind. Multiply in my mind. And I go to Dr. Sharma. Sir, that person told about you, and that's vomiting. Vomiting is something come out from the mouth through body, not from abdomen. That's in my mind. And I told you, Dr. Sharma, and vomit is, sir, that person say about you. And that after that I relieve. Now I am okay. Because I vomit out. And paralysis is the one another symptom. A father comes to home and say to her son, sit down. No, never you no go to outside. And otherwise I give you punishment. And the child got fever. What father says? Father paralyzed. Don't move. Sit here. don't go outside. And the child got the fever. That's why all symptom in the mind. So, Dr. Henneman, mind symptom gives the first chapter in our repertory. Mind is the first chapter in our repertory, and a single mental, rare, peculiar symptom is also a totality of symptom. And another symptom I discussion, because it's all theoretical. That is rubric is light desire for. You all, I think, you use this rubric in your practice. Light desire for. When first time I read this rubric, I says light. I desire this light, not this light. And Madam very nicely on skin diseases, they give the lecture on arsenic, lycopodium. These symptoms are all written in the books. Medorinum, cystic fibers. All these are the theoretical, and all these everyone know about the medicine and symptom of the medicine. I request you all, the homeopathic physician, believe in your master as believe in our religion. Thank you.
Hello. Up to now, everything is going well according to time, but I need only few minutes more.
Sir, my time.
Yeah, your best.
Thank you.
Once more clap for him, please. Thank you. This morning, I tried to connect with our chief. Oh my God. She's on the phone. Just a minute, she's on the phone with somebody. हाँ जाओ वहाँ खड़े हो, इधर खड़े हो, आगे. He is going, so you take the certificate.
Okay, one more.
पकड़ो certificate, पकड़ो गुरुजी.
चलो जी, चलो जी.
Thank you. And he is going early. Thank you.
इधर देखना था.
He booked the flight early. And I told him the function will be over by 5 o'clock. So he is going to Heathrow Airport. So if you come this side. Yeah. और पीछे.
Okay, sir. Look this side, sir.
Okay. Happy?
चलो जी. जाओ फटाफट जाओ.
Thank you.
Thank you.
Thank you, Dr. Saab.
Anybody didn't like the lunch, please raise the hand. You have to cook for everybody. My wife is raising the hand that she didn't like the food. You have to cook for everybody next time.
Oh, I like it very much.
I'm saying, if you didn't like that, raise the hand.
Food was very delicious.
Oh, रवि भावरा जी, वो फ्लाइट उड़ गई. खाना खा लो जाके. कब खाया खाना? खाना कब खाया आपने? 2 o'clock, but we are few minutes late. 19 minutes late. Doctor, please come. Introduce yourself and start.
Thank you, sir.
First introduce.
Yes, sir. Good afternoon. My name is Dr. L.S. Srinivas. Okay, I am from Andhra Pradesh, India, and I am practicing in Andhra Pradesh itself. And I'm an associate professor in the Department of Community Medicine. Okay, so my topic will be understanding the homeopathic management in cases of rheumatoid arthritis. So this is my topic, which I'm trying to address the thing. Okay, let us come to the rheumatoid arthritis. Okay, what is rheumatoid arthritis? It's is my voice audible?
Yes.
Okay.
You can put the microphone next to your mouth.
Okay, sir.
All right. Okay. So let me take it. So what is this? It's a chronic inflammation. It is a chronic inflammation. Now, what happens in rheumatoid arthritis is the inflammation of the joint. Inflammation of the joint is the primary thing, and then followed by the other system involvements like skin and the lung. We'll come into that topic later on. So now what happens in this rheumatoid arthritis is the inflammation of the joints is taking place. Now, according to the allopathic system of medicine, or in general perception, what is happening over here is rheumatoid arthritis is considered as a lifelong disease, where it may start in the middle-aged woman or soon after the pregnancy, and it continues throughout the life and causing various comorbidities, and the patient goes grim and grim day by day. Now let us go to the second slide. Okay, let us understand the little bit of anatomy. So now what happens? Usually rheumatoid arthritis affects the synovial joints. So now what happens? So there are the bone. When there is a cartilage, the articular cartilage, and everything will be present, and there are synovial fluid are produced by the synovial cells inside it. So synovial fluid lubricates. It lubricates so that we won't have any feeling of the pain or while we are walking. Any kind of an arthritis is just either you lose the synovial fluid or your synovial fluid is inflamed, and this inflammation will lead to erosion of the cartilage and as well as the bone, and there are some other issues will also be created. And as you know, there is a synovial sheath. We all know it. The synovial sheath, and there is the inner membrane, and there is a synovial fluid which is been inside, and it is again covered with a fibrous capsule, and we must be much aware that the cartilage will not get the blood supply, but the cartilage steals the blood from surrounding tissues. So that's why we have only blood supply to the fibrous capsule, and the bone itself has its own mechanism where it has Hevesian canals, and it will be having its own blood supply to that. So let us go to the next one. Now, let us come to this. Over the period of time, rheumatoid arthritis has, the causes of rheumatoid arthritis are per se what is the exact cause? If you take the textbook of medicine, okay, 80 or maybe 75% of the cases, you hear one specific word, idiopathic. I hope you all face this same thing. you don't know the cause, and then they will start saying it risk factors. Then they will start saying risk factors, and these risk factors keep on changing by addition. The textbook of medicine, the pathology changes year by year, year by year. Now, what has happened? Previously, in 1970s and 80s, rheumatoid arthritis is just termed as that there are some rogue antibodies which are coming and attacking the synovial capsule, and it has been believed, okay, it can be carried genetically, or sometimes it can be inherited. Now, let us see how the current theory goes to it. Now, genetically, it has been like human leukocytic antigen, we all know it. So there are 4 leukocytic antigens are there. The primarily, which are DR1 and DR4, are very much potential because it attaches the collagen 2, because the rest 2 other go for the collagen 1. So they will be having, they will be modified. And the environmental factors like smoking and pathogens, and the examples in the gut bacteria. Examples are the gut bacteria. Let us take it little simply. Now what happens here is, antibodies, especially IgM, there are 5 antibodies are there. Okay, especially if it goes to the cartilage, the IgM is for the gut and the mucous membrane. IgG is for the collagens and all these places. So this collagen, it usually affects the collagen 2, and as well as vimentin. Okay, anybody has a knowledge about what is vimentin? Okay, let us come to vimentin. Okay, it's a newer concept which has developed recently. So vimentin is a substance, every cell wall is made up of lipoprotein. Vimentin is a substance where it tries to adhere the cell to each other and keep them connected. And one more important factor of the vimentin is, and the negative factor of vimentin is, this is the factor where it gets hyperactive when there is a cancerous condition present inside that cell, and it asks other proteins to proliferate more and increase the cell mass. And it has its own role in rheumatoid arthritis. I will just come to that point. So now what is happening over here? Due to this mutation, these mutations are present inside the human body. Let us take an example. For suppose a mother who is already known case of a diagnosed rheumatoid arthritis. Maybe she is having 2 more children. Maybe a female, let's assume, because rheumatoid arthritis is more common in female rather than in the male. So now what happens is she is having 2 more kids. The first kid and the second kid, probably in some of the cases, they may not develop the disease. Despite they are having that gene in them, because that gene hasn't triggered. We need the triggering factor to make that disease active. So usually these environmental factors, the cigarette smoking and the pathogen. If you just closely observe rheumatoid arthritis cases, usually females develop this condition soon after their pregnancies. It has been believed by many of the physicians, say the reason is because there is a huge high influx of hormones during the pregnancy, and suddenly after the delivery the hormones will go down, and these are some of the factors will trigger it. And for that hormonal highs and lows, the main factor is the emotional state of the patient. Per se, a mother who has already suffered rheumatoid arthritis, probably the daughters whom she is having, still they are having that gene in them. If they are emotionally stable and they are well maintained about their emotions, mental health especially, could not trigger those genes, and probably they will not develop the disease. So we'll go to the next one. Now, these suspected genes, now what happens here is, there is an arginine, like when you take the gene of in the DNA, arginine is the one which is present over there, is the amino acid. Now what happens here is, usually RA factor, rheumatoid arthritic factor, is commonly found in many diseases. Now if you take some of the seropositive diseases, like ankylosing spondylosis, RA factor is positive. Or you take any other disease condition, you take Sjogren's syndrome. RA factor is positive. But what is so specific that if you want to call rheumatoid arthritis, there must be some qualification for it. Say yes, okay, fine, RA factor is positive in men. Like if you take an example, ESR, if the sedimentation rate is positive in autoimmune disorders, it is high, as well as it is high in infections. So likewise, RA factor is positive in many places. Now how to identify it is a rheumatoid arthritis or it is an arthritis which has been developed because something else. So for that reason, we have to understand physiology or the physiopathology, where what happens in this condition is the arginine is replaced by citrulline. It's a sequential amino acid inside the DNA, it has been changed. Now what happens? This change in the DNA will cause a genetic mutation on the type 2 collagen on the cell wall. Now what happens? This is the point. And the vermitin, which is present inside, will also change its nature. And now what happens? There are some cells, our own immune cells, they keep on wandering, and they see it, and they say, okay, fine, this cell doesn't belong to us. So now the allopathic system is understanding what is homeopathy. Now I will tell why. Why? Because we might have heard a word called as autocratic in organon. Yes, can anyone tell me what is autocratic? Sorry? No, what is autocratic? What is the nature? What exactly means by autocratic?
It will be driven, autocratic means selfly, automatically.
No, you are a bit wrong. Autocratic means it doesn't have its own self-intelligence. Right? I hope I'm right. Right? It doesn't have its own self-intelligence. Now, can you find it over there? Actually, there is a small DNA change inside the cell. But ultimately, after that change also, the cell belongs to us only. But our immune system is not that intelligent. Now, it's not that intelligent to identify the change which has happened in the DNA, happened inside the DNA, and is just believing that the change on the cell wall, and just proceeding with the disease. So the word autocratic, what Hahnemann has used 200 years ago, was very much right. So now what happens? These immune cells, and these cells, they will, as usual, these immune cells will travel to the lymph nodes. From the collagen. Now what happens? Inside the lymph nodes, now what is the usual process? These dendritic cells will convert into CD4 cells, and the plasma cells is all immunity. More amount of B cells are produced. Now all these B cells and CD4 cells will be driving back into the, releasing more and more antigens, which are specific to attack those cells, Now what happens? Now they come into the bloodstream. They will come into the bloodstream back again from the lymph node, and they will be carrying the attacks on the entire synovial membrane, and they will be releasing all interleukins and interferons and all these things which are chemoreceptors, which will attract more and more WBCs. Now what happens? The entire inflammatory swollen is called as pannus. So that's what you see, swollen fingers on the rheumatoid arthritis cases. And now what happens? It will raise fibroblasts and fever. But it is because of the trigger of the interferons, they're having the fever. And it goes to the lung and they causes some scarred tissues, and ultimately leads to fibrosis and pleural effusion. And in liver, they will secrete a certain protein called as hepcidin. Hepcidin reduces your blood cells, and in the blood vessel they will cause atheromas. They will ask them to cause accumulation of the atheromatous plaques. So what we understood till now is arthritis, the autoimmune disease which is been in the joints. After all the destruction, they goes to the body parts. Okay, and these are the body parts where it does. Remember that these two factors, the one is the liver, hepcidin, and as well as atheromatous plaque, are very much common nowadays. Let us see. Now how it goes. Usually common arthritis starts from the joints, metaphalangeal joints, and then from metaphalangeal joints usually swollen, and it goes to the shoulders, warmth, stiffness in the morning. Why? Because antibodies are high in the morning, and then later on it gradually reduces. CCP has to be positive, and X-rays and all these things are mandatory to understand the disease. So this is how the disease goes. Now, let's come to the part of homeopathic aspect. Let us understand with my own case, which I have faced in my clinic, and I would like to go with it. Okay, now I have a patient. She came from a little elite group, not like elite group, like the working class, like government officials, which are in a high cadre. And this lady turned up to me for her excessive pains in her joints and all these things. Now what happens? So these are the presenting complaints of her. She is a housewife, and joint pain since 5 years, during morning cold aggravation, crackling in the finger, just if she tries to anti-inflammatories are stopped by her. It has been almost an year and a half I have treating her, and now she's almost fine. Yes, she's still having those deformities. They haven't gone off. Yes, she's getting some flares, but they are controlled by homeopathy. So ultimately, I want to conclude this lecture, for you, is when you are taking chronic cases, just keep an eye on what are the allopathic medications they are on and what are the symptoms they are producing. Instead of rushing into the totality, instead of rushing into the conclusions, better check where are the symptoms, what are the side effects, what we are getting, and what is the exact totality, and what is an exaggerated totality. The totality what we got was an exaggerated totality, because there are complex, the disease complex is formed by another complex of medicines. Now, it is a challenge for us as homeopaths, for us now, is to understand not only the disease, but also the symptoms which are produced by the medicines, so that we can plan a better outcome to our patients. So, and for this, I would like to conclude my lecture. Thank you.
Very good. This was Homeopathic Intercity Express. Fast. Intercity Express. Wow.
Any doubts?
Thank you.
Yes,
Boss,
sir.
any questions?
Sir.
Reports regarding this matter of
Due to her confidentiality, I haven't, sir.
You just get done.
I'll just message you. I will just WhatsApp to them. Okay, because the patient is not willing. I asked her consent. She said, no, I just don't want to be. Like, yeah, one more thing in her case. Okay, one more thing I almost forgot to tell you in this case. The thing was, why she got the disease. The mental history. For the Medorinum I chose. There is an obsession in Indian society to having a male child. She had 3 deliveries soon in a challenge to attain that male child or to get a male child. In that due process, she was completely demeaned by the society, and she developed those symptoms after her second delivery. So for that reason, she was mentally down. At times I gave her Ignitia when she was mentally down with those symptoms, and she recovered fairly well. And this was the reason why I didn't bring her reports. So she was very much, so no, I have faced so much in my life, so I don't want to be like, how the people respond to these kind of things. So this was the thing, I didn't bring her things. I'm so sorry for that. But I thought this is one of the most interesting things to share with you, so I got this one. Any other things, sir? Yep. Yes, you want to ask? Yep.
No.
I had a friend in Greece, George Lucas. Yes, my wife. Yes. He was one of the best homeopaths I have seen. Very honest, hardworking, devoted to homeopathy, friendly, best hope,
Definitely.
and was host as well. I'm missing him today. And I met Dr. Nikos in Greece. And he studied from my college, Hahnemann College of Homeopathy. And this time he is promoting homeopathy, and he will explain you more. So I pass on to Dr. Nikos.
Thank you very much. Thank you, Dr. Sharma, for the opportunity you offer me. I am Dr. Nikos. I come from Greece. Dr. Sasi Sharma was one of my professors, and I'm very grateful for that. I practice naturopathy and homeopathy here in the UK, for the last 6 years, and we have developed an academy that the point of this holistic academy is to train doctors in different therapeutic modalities and how we can present a protocol where they can combine information from different therapeutic modalities, and the most important from these modalities is homeopathy. Because homeopathy can offer the opportunity to a medical doctor to understand the personality, to understand the kingdom, to understand the miasm of the patient, and this is very important information for many diseases to resolve them. So we are creating a short course with the essence of homeopathy, so that we will introduce homeopathy to medical doctors, and then of course we will present the full course from the Hahnemann College. We also, our academy is a hub to connect different doctors and professionals from all around the world that are doing research in homeopathy and energy medicine. Now that we are living the age of quantum medicine and all this artificial intelligence, promotion, we have to go further and develop skills so that we can connect the scientific and energy factors of homeopathy, and we can connect them with quantum medicine. So, listening to my fellows and very interesting professors that presented here today, I have to make some different investigations. First of all, for my research and other doctors' research, we found out that every homeopathic remedy is transmitting some kind of a field, and this field probably is a matter of light, is a photonic field. And we have researches that through our collagen network, the collagen fibers, all this information is communicating through the body. So probably it's not the nervous system, but it's the water in our body and the collagen fibers that are transmitting the information to the glands, to the brain. And through that, it's going to be emitted in our biofield, the photonic field around our body. So there is a lot of research we do how the frequency and the field of homeopathic remedies is connected with the distortions in the field of our body, which is mainly created by light. So I will invite you, everyone that wants to connect and communicate with our academy, to come in touch with me. We are very pleased to present people that have to offer to the community, and of course, training and experience and the learning experience is going through an exchange of information and knowledge. Thank you very much. Thank you, Dr. Sharon, and thank you, everybody.
Thank you, Dr. Nikos. We have got plenty of time. Go to famous homeopathy. Welcome, welcome, welcome.
Sorry. I'm practicing homeopathy for about 20 years. And first I would like to thank the organizers and to Dr. Shashi Mohan Sharma, and to say how happy I am to be here with you today. Now I will present you some new aspects of my work with patients. So, in the beginning, we should ask ourselves, what are incurable diseases? Every disease is a state created by the situation the patient is in, combined with genetic and karmic factors. Today, I would like to present you the new methodology we have gradually introduced to our practice last 3 years. It has shown great results, so I will be happy to share an overview of it with you today. In my practice, we are focused on first giving a patient his sole remedy similimum to improve his health in general, his level of energy, by making his vital force stronger. follow our patients for years by follow-ups, usually once a month, and we have noticed that after some time on Similimum, new teams are opening up. Those teams are not covered by Similimum because they're not coming out from the soul of a patient, but from his physical level of existence, his family, ancestors, and situations. All those remedies that are coming after the Similimum we call kamic remedies. When the first kamic remedy opens up after Similimum, we say that the patient enters his kamic labyrinth. Kamic themes are often associated with the family members, some friends, or some situations from the patient's childhood. During the conversation, we'll come to the whole story about that symptom. We'll ask the patient, when was the first time that symptom appeared? Almost always the patient will remember that, and then we'll ask him what was happening to him at that time. And that is how we come to the traumatic event on energy level. It is usually something like a death of a family member, breakup with a girlfriend or a boyfriend, or some injury. Trauma on energy level makes a physical symptom that in time will just get worse and worse.
So wonderful.
While the patient describes that situation, we observe which words he uses and which of those words he uses with the highest emotional charge. That words he uses with the highest emotional charge will then lead us to the kamic remedy. We stay on that kamic remedy for some time until the theme is solved. When we get to the point when there are no more emotional charges on those themes and stories, we can say that the theme is solved by that kamic remedy. After some time, the next theme will open up, triggered by some situation in the patient's life on the path through his kamic labyrinth, so we have to start looking for the next kamic remedy. Sometimes that happens very fast, and we go.
Thank you. Sorry for that.
Step by step, from one kamic remedy to the next, we are going through that labyrinth, and in time, if patients keep on working with us, we come to the next high level, like in a video game. Now I will present some incurable cases, very interesting cases, and how they were solved. The patient came in very poor condition. The diagnosis was bone metastasis. She came to us when even opioid patches couldn't relieve the pain for more than a half an hour. Her daughter knew me and knowing that I'm a homeopath, so she brought her mother to us, hoping that we could reduce her pain. They had already accepted that the illness was incurable and that the end was near. The patient described how the illness started. It started in 2006. She was diagnosed with a carcinoma of the large intestine. At that time, she was operated and the carcinoma and the part of the large intestine were removed. Then she received chemotherapy. Just a year later, she was diagnosed with liver metastasis and she again received chemotherapy. 4 years later, the cancer has spread to the bones and the tumor-like lesions were visible on her X-rays, and then that is the time when she came to us. The detailed description of the case taking and the first 3 years of follow-ups in this fascinating case was published in the homeopathic journal Homeopathy for Everyone 10 years ago. So, therefore, we will not go into details here, but give you an overview of the case. The patient has a robust bone structure, which has become more prominent since she has lost a lot of weight due to her illness. Despite being gravely ill, she was a strong-willed and energetic person, a woman of action. When she decided to pursue homeopathic treatment, she tried to cheer up everyone in the room after telling the story about her illness. When she sat down, her posture was quite peculiar, leaning to the right side of the chair, the position I have often seen in patients whose similimum is pteridium. From the case taking, we can see a restless and energetic person, disciplined, ready to fight for her objectives, feels like she's imprisoned in her apartment, likes to be on the move all the time, dedicated to work and very precise, relaxed by knitting, feels better in warm and dry weather, constipation since a young age, and likes oranges. Through the entire case taking, the team was present to make, not to make, which according to the matrix method corresponds to the code of the remedy Pteridium curasavicum. For example, she likes knitting not to calm down, but to make a scarf, or in another example, to make a house. After case taking, she was prescribed Hasimelimum, Pteridium curasavicum 330, and the next day after the remedy, her daughter told us that she felt much better, she had more energy, she was in a better mood.
Very good.
With retinal detachment, a condition that is incurable without surgery. The doctors informed her that without operation she would soon go blind. Her first symptom was experiencing blinding flashes of light while she was driving her car when the car approached from the opposite direction. The condition worsened to the point when even entering a room triggered the same effect. She also experienced other symptoms, coughing, fits of anger, and discomfort of a wisdom tooth that hadn't erupted despite her being 63 years old. All these symptoms began around the same time, so we prescribed the remedy for that totality of symptoms, Lotus 10M. After the remedy, her incurable problems with vision were gone within a few weeks, and all the other symptoms from the totality, the fits of anger, coughing, and even the wisdom tooth. Homeopathic treatment has cured her, while the operation would just suppress the illness to deeper levels, and the other symptoms. Thank you.
Thank you, Doctor. Thank you very much. Now I will request our patron, Mr. Vinder Sharmaji, to come here and bless the audience, please.
Thank you very much, Mr. Sharma. Bless may not be the right terminology because maybe in our culture, age always matters. So as a senior, he might feel it that I blessed, but it does not mean that I got any blessing powers. First, it's a great honor and a privilege to come and join you this afternoon. When Mr. Sharma told me, as most of you may be aware, that we are having some Diwali events all over the place, and you are always invited to come, not for the free sweets, but certainly to join them in celebrations. I was around and I promised him that I will drop in sometime during the day So I'm glad, and I'm glad that Dr. Sharma and all of you giving the service which is very dear to me. In the parliament, I set up the groups on alternative medicine, which I chaired for many, many years, and I always supported the alternative treatments in the society, and I think the British system need to adopt that as a part of the NHS system. We are campaigning on it, and I'm sure that one day the NHS and the British government will accept our demand on that issue, and I'm sure that you will carry on campaigning as well, where you're giving the service to the people and also making sure that this becomes a part of the system in this country, which at the moment is not there. It's not that every GP have the service and everybody is recognized. I hope that you will become part of that campaign as well, and if there's any time you feel other than the medical treatment, I will be happy to assist you in any other matters. But have a wonderful day, enjoy the day, and I look forward to working closely with you. God bless you all. Thank you.
Thank you. Sir, you have to give us some extra time because you are going to. Yeah, please. Thank you, sir.
Thank you.
I remember the day we had a big, seminar at University of London. And many of the delegates from India and other countries, they said, let's go and see the parliament. I thought, I will take you to the parliament. And all of us went to the parliament square, and they said, how you will go in? Will you be allowed inside? I said, don't worry, don't worry. I called Bhai Sahab, I called him Bhai Sahab. Within a minute he came out and everybody was in the parliament. So that was a wonderful, wonderful feeling. Sir especially came out and we got this badges and everybody was enjoying House of Lords here and there. Thank you, sir. You always helped me since long, long time. So our next speaker could not make it to United Kingdom, and his name is Dr. Jay Verma from Lucknow. But he was adamant, I want to present the case, I want to speak to the audience. So I will try to link him from India, and if he is available, then we go on, otherwise I will take some time from you. Hello, Dr. Verma.
Yes, sir.
You are next in the meeting. So they can't see you because of the projection is problem from phone there. So I'm putting it on the speaker. You can start your lecture, whatever you want to share.
Okay, okay. In this phone only?
No, it will go, they will hear your voice.
Okay, okay, okay.
Dr. Jay Verma, first you introduce,
Okay, okay.
then you start your lecture. Can you hear him?
Okay. Just hold on, sir. Yes, sir.
Can you hear him?
Hello, everyone. Hello, everyone. Can you hear?
Yes, they can hear you.
Hello, everyone. This is Dr. Jay Verma from Lucknow. I'm practicing homeopathy from last 15 years. And I'm so thankful to Dr. Sharma sir for giving me such a beautiful platform for me. And I'm also thanking you, all of you, that you are please be patiently listen me. And what is the I'm just gallstone and gallbladder cancer. This type of topics, when you heard from a patient, then you just respond to the patient, just go for the surgery and do nothing, go for surgery. There is no hope in homeopathy because there is a multiple complications of gallstone and gallbladder cancer treatment. When you are giving, you are facing that type of complications. So I'm here a case with a gallbladder cancer and gallbladder stone, and with some insight of valuable things which I am gaining from my practice. Okay, sir?
Okay, are you listening? Are you hearing? Yes. Okay, go ahead.
Yeah. Let's start. I'm just putting my camera.
But the problem is I can't give the projection.
Yes, sir.
Dr. Verma, we don't have a linking of projection which is already settled with the.
Okay.
You can carry on.
Then I'm just giving in audio form. Okay, sir?
Yes.
Gallstone and gallbladder cancer are a serious health concern, often intervene, presenting challenges for both patient and healthcare providers, right? This presentation explores the epidemiology of gallstone, their relationship with gallbladder cancer, and present a compelling case of Mrs. Manju. This case fully understanding. Oh, hello.
Hello. We are all coming to Lucknow. We all are. Miss Dr. Verma organized my event in 2022. Very big show. Very good hotel. Very good food. And delegates from all over India and abroad. Thank you, Dr. Verma.
Thank you, sir.
I could not link you the screen. Otherwise, they were enjoying you more.
Okay.
Thank you. I will call you later in the evening. Thank you very much. Thank you. Bye-bye. Going fast, early, because he finished very quickly, and Dr. Lakur also finished very quickly. So let's go far. I have got two things to share. It's a very special case of my life. डॉक्टर साहब उनको बैठा लो सर, आप उधर बैठ जाओ भी. We are coming. I was in India in 2018 promoting homeopathy in various cities. What is this? I was in India in 2018 promoting homeopathy in various cities of India. So when coming back from Delhi to Kanpur, because it was Dr. Hemant Sachan who was the chief organizer there. So my brother lives in Lucknow and my other family is also in Lucknow. So we were coming back from Delhi. Early morning we reached Kanpur and then said, sir, please can you see a patient, a very important patient for us, our family, very close to them. I went to see them and then I found this lady which I am talking today. She is the wife of a multi-millionaire, real multi-millionaire. And she was lying in the bed, totally comatose. No eye opening, no talking, no food, nothing, everything was going through the food pipe. I was shocked. They arranged a good treatment room and everything, a special nurse. I'm telling you, I never lied. I was never hopeful that I will treat this case properly and successfully. I believe in Hahnemann and homeopathy and my knowledge, but that was a very, very special case. And before I went to see the lady, they quickly made the tea, very good tea and very good biscuits, there almond biscuits and everything. I was not sure why this. I said, no sir, you are our guest, first take the tea and some refreshment, then we go and see her. And when I entered the room of that lady, it was a very big room, half this size room. Because they are very rich and multimillionaire, they had a very good property. And there was one hospital bed, white. A nurse was sitting there. She was very intelligent nurse because I couldn't see the way she was helping the lady. And there was no short of funds, so they are the best stock. And the lady was fed by tube. Any food, tube. Urination, bed, everything, commode used. So they had trust on me, that's why they said, please see this lady. And inside me, I'm telling you, I was not very sure. I'm not saying I'm disappointed, I was totally helpless, but I was not very sure what will happen to this lady. Then there was no need of history because you can see yourself. It is an objective case where you can see what is happening. She was lying this left, mouth was fed the tube, no movement, and her right arm was very stiff like this. And she was lying in the bed for 4 years. They did everything for that lady. Name is Pratima Vaid, you can see up there. 66 years. That is now she's 72 or 73. She's alive. And they had no hope. All the doctors from India, the big hospitals in India, top hospitals in India, they didn't do anything for her. So ultimately they said, go and take care of her. And she was lying in the bed. Husband, so good, very honest. He never gave up. So I could not ask anything. That was the subjective symptoms. But objective symptoms was that she's lying in the bed, she's like a log, eyes are closed, hands are stiff, and she lost a lot of weight. So the first thing I noticed was paralysis right side upper limbs, like this. Unconscious since 2 years. She was going on the treatment. The day I saw, she was unconscious for 2 years. And when I tried to touch the hand was stiff. And she was fed by the tube. So I didn't have the many symptoms, but depending on the minimum, I gave causticum 1 dose and told them to give Kali fast to strengthen the nervous system. 10th November, Kali fast and then causticum was given. On 28th November, I came back to UK and then they said, sir, there is no improvement. Rather than changing the remedy, I was so sure the causticum is the remedy for this lady. So I gave causticum 10 mg. It was given by Dr. Hemant Sachan, who was my assistant and my student. And Kali fast 4 times daily. 12th December 2019, there was not much improvement, very slight improvement. Then I asked him to give 50 mg 1 dose of causticum and Kali fast and magnesia fast to help. 4 tablets of each 4 times daily. 2nd January 2020, patient opens the eyes and start responding. Oh my God, something is missing from. Okay, I tell you now, there's something missing here. And now she is eating everything. She is awake. She is talking. She is responding. She is showing sentiments. She gets angry. And she says, like this. So never give up hope. If you are adamant that you are going to treat the patient and you are not, what's happening? Something wrong? Okay, thank you. So ultimately, she is back to life, but hand is still stiff. She's eating, she's talking, she's calling everyone around, and that is the most miraculous case of my life. There is another case of Gurdeep Kaur. She was about 70-year-old lady with a black skin all over. It was a chronic eczema, dermatitis. I treated her for 11 years. Why 11 years? She got better. Even then she said, I want medicine, I want medicine. And she was a Punjabi lady. She was calling me Puti, means son. Every time she was coming and her son-in-law was bringing her. Her skin was totally black, shriveled, and she could not tolerate heat. Can anybody tell the medicine, I give you £10 cash now? Cash price. Black skin, intolerance of heat. Huh? Which one? I give you £100. £1,000 last price. Lachesis. Lachesis is a remedy which you should not repeat. I gave 1 m. And after a few days she was feeling better. No cooling. Then I gave Lachesis 10 m after 2-3 months. And there was a one set of 50 m with me. One company called Wilmer Schwabe. They sent 3 sets of 50 m. Important Polycrest. 2 were sold. Third was lying in the Ainsworth Homeopathic Pharmacy. They knew me. They said, Peter, there's a name. Peter, he said, Dr. Sharma, I've got a special offer for you. I said, what is the offer? We have the set of the 50 m. I said, okay, that's good. All Polycrest remedy 50 m, original. You know which year I'm talking about? Which year? Not now. Which year? 1994. Long time ago. I told him, Mr. Pankaj, Tony, how much is the price of this set you have? He said, £3,000. I said, I don't want to waste £3,000. You are not selling the kit and you want to sell to me for £3,000? Maybe there are so many remedies I don't know. I will use it or not. He said, Dr. Sharma, I'm giving you offer, half price, immediately. I said, £1,500, not bad. Then he said, where you are coming for this set? There were only 3 sets in the United Kingdom. One in the London hospital, Homeopathy Hospital, one by Dr. Roger Savage, third was me. Then he said, don't worry, you take the set, we know you. Because I organized some event that time. He said, you can pay me 3 installments of £500 each, and whenever you want to give. I said, no, I won't give you that much money. He said, well, how much you want to give? I said, I will give you 250. He said, okay, you give 250 every 2 months. I took that 3 full set of 50 m, original medicine, made by Wilmer Schwabe, Germany. From that set, I gave 1 dose of Lachesis, 50 m. After 3 weeks, 4 weeks, her skin was like cloudy sky and the fading. Her skin got better and cleaner. Then he said, I want that medicine. I said, no. So I give the placebo to avoid the aggravation. In 2.5 years, her skin was pure white, like natural. This is the magic of Lachesis. Even then, she said, no, I come. Every month they were coming and giving me £30 for the medicine. Her son-in-law was very nice. He was treating her like mom. Sadly, after 5-6 years of treatment, she died. And when she died, I was so sad. Because she was my regular patient, so I and my wife Sunita, we went for the funeral at Mr. Sharma, which is that near the hospital, the funeral? Which one? Handsworth, yes, sorry sir. Handsworth. And you know how many people were there in the funeral? 6. Generally there are 100, 150, 200, 300, 400. Because they were thinking, oh, okay, let her die and we will take her home. This is a bad thing. People are money, very cheap. Another case was a man of Pakistani origin. He had a big problem. Very sensitive to cold, very impatient. He was calling me about 5-6 times a day, and once in the night, I'm dying, help me. and his son was living next door. Dr. Chaudhary, real son was living next door, he was not helping the dad. Why? Tell me why. Tell me why. He said, let him die, I will get this home. No money, there is no love, no parent, nothing. So I treated him for 1.5 years, and he got a lot of better. One night he had a heart attack and he died. So, this is a matter of thinking, what are the relationships here? Nobody loves anyone. They want money. So I go for another 5-10 minutes then, because then we will invite our patron and we start the graduation ceremony. Maybe finish early. I want to show something which you will enjoy. Let's see. Let me pull out something. I had one great friend from America. Most popular speaker in the world. And I want you to see him and listen his voice. Because I don't know when I've had this time again to share with you. Let's see. Few minutes. I'm loading that. Dr. John Bennett. Can you hear him? Yeah. If I start again, then it will be full screen.
Tell me I was gay. Stephen Novella. How come you didn't tell me, huh? Stephen Novella's gay, isn't he? You want to know Stephen's gay? Of course. Well, how do you know? Did someone get an urge to go shopping? Redecorate? Not wearing any socks? After 8 years, he must have been I'm just kidding, huh? But really, I mean, what's it gonna do? I'd like to thank all my homosexual friends. The others were with John Queen, the real workers, and we're so good at keeping our secret. Oh, Ray, I see you there, Ray, you stinker, you. And Martin, I see you there. And Penn and Keller, there's so much fun backstage, playing hide the garden roll up. Oh, and Harriet Hall, you old fag hag, you. Well, just kidding, okay, Carl. Okay, and Simon says, shut up, just shut up. And pets are nerds. Ooh, I didn't help myself around a man in a Nazi uniform. Ooh, I just love it when he showed me his swastika. That too.
You got.
वॉल्यूम में तो चल रहा है ना वॉल्यूम में नहीं चल रहा सारे सुन रहे
See the names. Shantikans, Florence Nightingale, everyone. Follower of homeopathy. Thank you. I request doctors, have a seat, sir.
Okay.
Oh, you are real in time. I respect you for that. If I am 30 seconds late, you will kill me. I am on the door. Come on, come on, come on. Sir, welcome. We had a nice day. And we have Mr. Virendra Sharma ji, our patron. And he's ready, so you get ready. You want to speak something? All right. Then go ahead, please. And put the gown, please. Siti,
Yes,
why are you sitting there? Get your gown. You don't see we are putting a gown. Anyone else getting a certificate today?
जिन्ना जिन्होंने मिलना नहीं पालो गाउन फिर शर्मा जी तुसी अनाउंस करो इन्हें दसो जिन्होंने देना तुसी दिल्ली
Thank you. There was some confusion and we have done it right. Better late than never. Mr. Tony Haynes, please come on.
Tony.
We need you to give the certificate. Thank you, Mr. Haynes. The first.
इधर देना किधर देना है इधर देना फिर ठीक फिर इधर आ जाओ
Come here. We need you, Doctor Bangalore. Come here. You come here. Take the because you have to give me certificate. Thank you. Thank you very much for this. We just had extra time. Our first certificate goes to Dr. Sohan Vinekar Gopalkar. He will also give one you and one him.
Okay, we both. Yeah. Okay.
शर्मा जी
I can-
please come forward शर्मा जी yeah
Sir, open go.
send to you शर्मा जी
Sharma bhai, sir.
that's it okay right here okay one another one sir thank you
Thank you. Congratulations. The second goes to the senior Gopalkar, Dr. Vinay Kumar Venkat Rao Gopalkar.
yes sir this side sir yeah sure.
Well done.
The most dangerous lady on the planet Earth. You know who? She's laughing. Dr. Siti Hadar, all the way from Singapore. Very dangerous.
Price.
You stay here, then we'll take the group photograph, yeah?
Okay.
Siti, you are happy?
Happy.
You playing late today? Okay, these are the, Dr. Hassan was in a hurry, so he booked his flight to Glasgow and one at Dundee at 4:30. So I already give. Now we are presenting some certificates to those who attended this. Dr. Vinay Kumar Gopalkar, attendance certificate.
Okay, sir.
My dear Dr. Anil Patel, Dr. Anil Patel from Bamley. That's the full detail.
Okay. Thank you.
Dr. Randeep Singh Sandhu. Dr. Sandhu, certificate for you. You are going to show everyone there that you was in London.
Thank you.
Dr. Sohan Gopalkar, certificate of attendance.
Yes, sir.
If somebody is from Bahrain, if the flight landed from Bahrain, please come then. Dr. Zuhairi Amir from Bahrain. We will have the group photograph.
Sir. Sir?
Oh my God.
ਸਾਡੇ ਟੈਲੀਫੋਨ ਤੇ ਬੰਦ ਕਰਵਾਇਆ ਤਾਂ ਉਹ ਖੁੱਲ੍ਹਾ ਰੱਖਿਆ
And now Dr. L.B. Sarania Gutukevi.
Okay. That's it.
Oh, very dangerous man. From Lahore, superhero. Who is Lahori? Come on then. Dr. Amjad Ikram. अरे यार लाहौर के और कौन हीरो है? You are the only hero from Lahore, Pakistan.
Yes, sir.
Welcome back to Islam.
And another hero from Lahore, Pakistan, Dr. M.K. Raja.
Thank you. Thank you very much. Thank you.
Okay, ਜੀ ਇਹ ਤਾਂ ਘਰ ਦਾ ਬੰਦਾ ਹੀ ਹੈ
My dear friend, Dr. Andreas Kelemen from Serbia. Welcome. Dr. Stojan Promovic, please come. Dr. Promovic from Serbia. Dr. Pomovic from Serbia.
Thank you very much. Thank you very much.
And my most favorite, Dr. Mirjana Zivanov. Here comes the madam.
Over here. Thank you.
Dr. Navjeet Kaur. नवजीत जी नाम सही है पर ना नवजीत है ना डॉक्टर साहब ऑफिसर होने से डॉक्टर सुखदेव सिंह कालो डॉक्टर द किंग ऑफ पंजाब चंडीगढ़ the Queen of Bathinda. The Queen of Bathinda, Dr. Rajani Jindal.
Okay.
Dr. Bhagwan Kaurji from Faridkot. Oh my God, oh my God.
Okay.
Is that free? We are going to Scotland.
I'm here. Excuse me, I'm here. Thank you.
From Scotland, the Queen of Glasgow. Mrs. Azma Chaudhry. आ जाओ मैडम आ जाओ प्लीज don't worry it will go आज ही another final testing the king of Scotland Mr. Dr. Mohammad Amin Chaudhary it's okay that was the testing Aju bhai all right nothing to worry the superhero from Hounslow Mr. Ravi Bhamra
Thank you.
Dr. Sultana Nazanin Dr. Suniti Gopalkar Dr. Suniti Gopalkar Oh, my friend from Greece Dr. Nikos Chatabilis
Thank you.
Okay.
Thank you.
Nice to meet
Hello.
Thank you.
So I missed your lecture. Okay.
Thank you.
Ramizan, there was some spelling mistake, we will do it. This was made by someone, yeah. Thank you.
Thank you.
Dr. Tasim Lal Garg. डॉक्टर तस्लीम लाल गर्ग डॉक्टर साहब उसमें नाम नहीं सही था ना चलने दें
कोई गल नहीं सर
नया लगाएंगे प्रॉपर
दिल्ली में हाँ जी डॉक्टर
थैंक यू
Oh, very danger here. They are honest. He is a lovely person, kind person, generous person, very helpful, helping me 24 hours a day. My dear friend, Dr. Mr. Chairman, Professor Jafar Janjua, please come. He is advising homeopathy to others. That's why he is getting promotion of homeopathy. Mr. Jafar Janjua.
Thank you.
And he is the senior security officer of a very big hospital in the United Kingdom. What's the name of your hospital? Heatherwood Hospital. Very big hospital. Even the Queen goes for the treatment. Happy, Mr. Janjua?
Thank you.
Happy? किसी को किसको अपना दे क्यों नहीं रहा भाई he is not giving his own trophy. Very good speaker, Dr. Lakur Samira. Congratulations, Dr. Samira. Whenever you see this, you remember all of us, okay? Okay. Anyone left? Anything left? Any left? Dr. M.K. Raja? मिला आपको सर्टिफिकेट पक्का थैंक यू सर Have a seat, then we'll go in few minutes. Yeah, you have a group photo. Please come, all of us.
You still in the House of Commons?
I just stepped down.
Come here and get a great.
Okay.
Dr. Kulwinder Singh, Mr. Promvik, please come. Dr. Stojan, you come.
आप आएंगे?
ये नहीं, photo नहीं like कर.
अच्छा.
With the preacher, he is the preacher, he is the most popular preacher in the world. अभी बमरा आ जाओ, आप ही आ जाओ. इन्हें क्या नाम बताया नहीं.
So you okay, right?
नीता आप भी आ जाओ ना. Come.
Okay. Okay. Keep your eyes open, please.
One more coming. One more coming, don't worry. Mr. Janjua, आप भी आओ ना, Dr. Janjua. Come here, don't worry.
Come here. Come here. Come here.
Come here. Those who, Dr. Priya, आप भी आ जाओ.
Everybody comes. Accept the photograph. Accept the photograph. ठीक.
What about you? Suniti ji, you are not coming? Come in the photo.
सुनिए आप चेयर पे बैठ जाइए वो चेयर पड़ी है
डॉक्टर अमीन आपने फोटो खिंचाना है आ जाओ ना फिर आ जाओ The king of Glasgow will never allow me to enter Scotland. Asma ji, you want to come? वो भी आ गए, अस्मा जी भी आ गए. One more. Thank you very much.
Okay. Can we have a photo of the photographer, please? One more. One more. You want photo of the photographer.
That's it.
You can leave your badges here for the use for the next year. Can you?
Okay, look this side. Okay. One more. Thank you.
Thank you very much.
That's it.
Oh, sir, fellow photographer.
Thank you. One more. Yes, sir.
Thank you. Thank you everyone. Go.
Okay.
No, sir, you come inside. No. You have to be.
All right. Thank you.
ठीक है सर, थैंक यू.
Okay, madam.
Thank you.